Here to tell you about Dr. Anthony Panozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Panozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Panozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Panozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Panozzo Sports and Medicine Hour.
Hey!
We got a really great show today. I mean, not that the others weren't great. I always want to say hello to you, Dr. Panozzo, because you are the show.
That's Les.
And I'm Les.
But he's more.
We always have Mr. Freddy Santori of amp2.tv and his son, Gio. And we also have Colleen.
And we have Linda.
We have Linda on the keyboard here. So we've got a whole crew, and we're ready to talk to you about the most important thing in the world, pain. What causes pain?
Everybody has pain.
You know, Doc, I want to talk.
What a pain is?
No, what is pain?
Well,
Hold it.
A pain is an electrical phenomenon, first.
Whoa.
And it starts wherever the pain is and goes up to your brain and registers there. You can measure this.
Really?
Yeah, you can measure it.
Every time I'm with you, I have something. There's always something new.
Okay, let me say what it is. So,
okay, yes. Amazing, isn't this? So today.
So the other part of the pain is inability to stretch.
Okay.
Think about it. You have a back pain, you can't bend.
Correct.
Well, that's the inability to stretch. So that's a description of what to look for on a clinical basis. So you can't test everybody electrically. It takes too much equipment for that, too much time for that. You know what happens, though.
Oh, yes.
So now, if you think about why does bending bother you or pain, then you have to ask, where does it bother you? Which side?
Mm-hmm.
Right or left? Up or down? Does it go in the leg or not go in the leg? And now the people who want to control some of this, they get it wrong. They get the opposite thing. That we just talked to somebody from a big insurance company about this very thing, that their requirements are backwards.
Right.
And they're holding me back on what I need to do.
Well, they were holding you back until you spoke to them.
Well, who knows what they're going to do now? But I think the literature is actually wrong, and I've read it. And it's done by people who do not have a clinical practice like me. And I should do it, but I can't get anything published because I'm a nobody. I'm a little guy in Delray Beach. I happen to be very, very smart about this thing, if you don't mind me saying.
No, you can say, let me tell you something. You know what? Stupidity is doing the same thing all the time and hoping for a better result. So these people that we met two people, which is amazing, Freddie. Two people that suffer from vertigo, but here's just the funny part about it. One was in their 70s, one was in their 40s. And the one in the 70s was talking about how great this man is, and the one in the 40s says, oh my God, both had the same ailment that he cured.
Vertigo.
Yeah,
cured vertigo.
Vertigo and headache. Vertigo and headache.
And TMJ on one of them.
And the vertigo, though, that's the big news, because everybody else thinks it's in the inner ear.
Yes.
And it's crystals, and the whole thing is really ridiculous. I never understood it, and I never appreciated it, even when I knew about it in school. But by accident, we discovered that these two ladies had vertigo and all went to the same doctors around, and all got treated the same way, and they both of them ended up in my office at the same time. So we took care of the older lady first, and that migraine area, put a shot in that, and that took that migraine and the vertigo out. Now, she was in the chair a minute after I gave that shot trying to get her vertigo back, and she could not do it. She could not do it. And so she talked the other lady into getting this done, and of course we did that. And then she had trouble when did she have trouble actually, Les? At the stoplight or something?
When she would be at a stoplight and she would start getting dizzy because the vertigo would kick in because she had trouble with visualizing certain things, and when she stopped, she was. But when she drove, she was okay. But when she stopped,
okay. So after the treatment, then.
Well, she drove all the way home with me and was comfortable.
She could not get that.
No.
Yeah. Okay, so that's pretty good proof. I mean, it's not. You see, the problem with proving these things is that it's all subjective, and you have to believe who's telling you that. If it's gone, you have to believe that. If it's not gone, you have to believe that. But you can't put your finger on it. You can't test for those things because they're untestable. But I mean, my headache is a referred pain. This is what I think it is, and we know that because we treat it, and we take the pain out for structure. And now we're adding the vertigo to it. Now, anybody listening to this ought to come in here in my office and get this evaluation and get this treated, because it's very fast. It's one time, and you're going to get rid of your vertigo. And now the ear doctors are now recommending this. They don't think in these terms. Remember, now everybody has their own specialty, and they're very good at what they do. But I'm saying, hey, you got it. Sometimes you have to come out of what you really know, and stress the level of competence, which is what we're doing now. And so if you have vertigo and headache, it's all from the same place. You come right in.
TMG or migraines,
We'll knock that out in no time at all.
You know, that's really amazing, because there was a baseball player that played for the Minnesota Twins, and he had vertigo, and it cost him his career. And then they made a movie about him. Remember? He used to be in center field, and the whole stadium started spinning on him, and he used to run into the dugout.
I can't remember his name. I saw the movie.
But once you give out the number, if anybody can remember the name here, help us out.
You can remember who the guy was, the baseball player who had vertigo. Give us a call at 800-889-0267, or if you are suffering from this, Dr. Pannozzo is right here in front of us. 800-889-0267, and Cohen's not getting mad, so I said it's slow enough, right, Doc?
Well, listen, call up if you have experience with this area. You want to talk about it. These two people we're talking about, and there are others too.
It's true. I mean,
have been everywhere. I mean, these are educated, pretty wealthy people. Nothing held them back. They went everywhere.
But isn't that amazing that the two people went through the same things at the different? They went through the Botox. They went through here. Let me give you an example. And I'm going to read my research, Doc. If I get up at 6 o'clock in the morning to research this, they said a lot of neurologists are doing repositioning, they call it, which is to work the crystals out of the inner ear to make it.
So there are crystals in your ear?
That is so much baloney. I mean, just think about it. You know, I just can't understand.
A crystal in your ear?
Moving crystals in your inner ear.
I didn't even know there were crystals in there.
Come on.
You look like you got a crystal in your ear.
If I had an earache, I just rubbed the crystal. Okay, here's another one. Exercising the eye and head movements to get rid of vertigo.
Again, that's stupid. But it's related to what we can treat.
Right.
You know, when you move your head, you are moving the structures in your neck.
And I want to talk about, before I go on to the next one, let's talk about semantics. This is very funny. Nowhere in all the research that I've read about Tommy Jones, Tommy John, Harry Teeter, no one ever says, they always say, will relieve pain, but no one ever says it'll cure it forever. He does.
Yeah, but
that's the
copper
funny
doesn't
part about
relieve it.
No.
Half the things that they're talking about doesn't relieve it. Crystal in the ear, take my eyeball out and put it back in. I mean, that stuff just isn't working.
No. It just says it makes no scientific sense.
That's exactly right.
But what I'm doing makes scientific sense. It's an area that you can reach. You can do it in 2 minutes. You get the result. It's not prolonged treatment. It's not prolonged anything. No drugs at all. You just come in, we evaluate that. If you have what we're looking for, It's one treatment there, and that's it. That's all you get. It's
You
one
just
time.
said something about medications, okay? Medications they use is Valium, but may cause quite a few side effects, but no cure.
Linda,
Linda,
coming now.
we need you over there on the sign thing. Okay.
Valium you don't want to take.
No.
All it does is make you sleepy.
Well, yeah, that's
There's
what
no other effect than that.
But the thing is, which is amazing, is no one says that they'll cure you of it.
Nobody, no.
Nobody's going to say that.
No, except
No,
him.
I do. I say that.
We should have T-shirts made. Pannozzo Cure.
Yeah,
I mean-
those are cures.
Pannozzo Cures.
C-U-R-E-S. Those are cures.
And then on the back
And
of the
what?
shirt, we list all the things you cure.
Well, we're gonna
It's going to go down your back,
We're
down
gonna-
your leg.
We're going to need a very big shirt, one of those real big ones. Here's
We're
another
trying-
one.
We're
Two
trying to have
lines.
fun, but actually this is very serious business.
It is. This is some breakthrough, Doc.
It is.
They're also prescribing Topimate, T-O-P-I-R-M-A-T-E. And here's something that actually happened. There was a whole list of people who suffered from vertigo who went in for all this medicine. And after 3 weeks, 50% of the patients said, quote, caused depression after they stopped with the medication and never really cured the vertigo.
Right.
Okay.
Yeah, you can keep your anxiety under control, but you're not really going to go after the structure causing this. And it's not the inner ear, ladies and gentlemen.
Cause and
But try
effect.
me out. Hey, you want to challenge my thinking? Come on in and let's challenge.
Well, remember what the challenge is.
It's okay.
If you come in and he does not cure the pain you came in with, we're
Les is taking you
Listen,
to Europe.
if it doesn't help you,
Not to
it
Europe.
doesn't, I don't feel bad about it. I just say, well, this is why it didn't help, and we're not going to do that again. So, it's a research thing. That's how I think. Every day you have to evaluate what you're treating and how you're doing it so that you adjust it every day. Every patient gets adjusted for new thinking. So, yeah, come on, do that. Here's another one.
I was going to talk about this Mayo Clinic study you were talking to me about in the car.
Mayo Clinic. Well, they want to treat intervertebral disc regeneration
What
with
is that?
stem cells.
You know who? What?
Well, first of all,
Never heard that one. Go ahead.
intervertebral disc doesn't happen. It's two parts. One is the inside, which is more of a toothpaste consistency. It's a liquid.
Right.
Now remember that it's a liquid. Surrounding that is a ligament structure where the nerves are. So inside there's no nerves. Outside in a ligament structure, and the ligament is arranged. It goes up and down, sideways, and around, so that you have all the motions you want to do. So you can do all that. See, and that's all the ligament structure bending and stretching, and it's normal. So when you talk about degeneration or regeneration, it's not that at all. It's a repair process. If you injure the ligament structure, it's the same ligament that goes to the knees, hips, the neck, shoulders. It's all the same ligament stuff produced by the body. And it's all to protect motion, so that if you injure it, then you're going to have a pain, and that's when the inability to stretch happens. Okay? You see, it all ties together. But stem cells are not going to take care of that. First of all, stem cells only occur in utero before you're born. And you need chemicals to produce the change from stem cells to ligaments, muscles, bone, so forth, so on. It's not going to happen outside the womb. It's just not. Humans don't have that ability to get that reaction to take place. It's a chemical reaction to make sure the stem cells get evolved into muscle, ligament, bone, brain, whatever it is.
So how
That's
would
why
you,
they call it stem cells. Well, the whole thing is stupid to do things.
So
like
they're
to do
saying
research like this
they're
because
gonna-
it doesn't make any sense.
they're going to put your stem cell in the region to recreate something that you can't recreate anymore.
Well, that's right.
wow.
And I didn't even go to medical school.
That's exactly
You're right.
Freddie, you are
Holy
Go, Vince.
mackerel.
That's what Freddy gets for that one. Very
But
good.
you know something? But it goes to show you, because I thought stem cell was recreating cells to make repair in the heart, liver, and yada, yada,
Not
yada.
true. Not true. You need a chemical reaction. Something has to get the stem cell to change into heart muscle, regular muscle, ligament, bone, on and on and on. And unless you have that, it's not going to work. People are paying $2,000 for that, $2,500 for this.
And that's probably not even covered.
It was never going to work in the first place. I mean, don't do that, people. I mean, I'm trying to save you some time and effort.
And money.
And money.
I mean, money is important. You know, what I've always pictured in my head is if someone has a pain, I don't know about you. Well, I know about you because you're like me. If we have pain, we want to get it fixed. We don't really care. So, you know, insurance to me is good to have, but you know what? Pain, I don't want to have. And we're not talking about a lot of money to see you.
No.
I mean, I've seen these people that are just blown away. Thursday was an experience for me. Out of all the experiences I've had at his place, this was the biggest experience.
It's very true. Don't let your insurance company tell you how to get treated.
Or dictate how you get
There's
treated.
two areas in life that, in my estimation, should never be trusted to anybody else.
Money.
One is your health. You better know what the hell you're talking about, and who you're going to, and what you subject yourself to. And the second one is your money. Anybody can lose money for you. Very few people can make money for you. But you got to be in control of those two things, your money and your health. I think that's pretty good.
I think so.
Really?
You know, I had someone
I
that I
agree.
was going to bring to see Dr. Pannozzo on Thursday.
I'm glad you didn't. We're busy on Thursday.
Well, she sent me a text
Right.
with hooray, yay, 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 all of this, hello, you know, I'm happy. So I said to her, what's going on? She says, I was approved for dual hip surgery.
Oh,
So I said to her, and you're happy? She goes, absolutely. I'm in dire pain. Do you know how long I've been waiting to be approved? Now, I don't know who's doing the
Now,
approval.
see, she's wrong because right then and there, she's wrong. One thing, pain is not what you get operated for. Yet they will operate for pain all the time.
Right.
They won't tell you where the pain's from. It's from the ligament structure around the joint. That's treatable. But you'll never hear that from a surgeon because their whole thing is replacement.
Yes, that's how they make money.
They don't send anybody to me for treatment of this area because I can do it. You know, you show up there and you keep showing up there and they don't do anything for you and you show up again and then finally you say, well, let me get this operated. You ought to ask their surgeons, send me to someone who treats this.
Well, Doc, they sent her to 5 opinions. 1, 2, 3, 4, 5.
Wow.
She listed them.
Who are they?
I don't have them. I don't have
They're
them.
all orthopedic surgeons.
Yes, they are.
Of course.
So I said, okay, number 1 was wrong. And I went, number 2 is wrong.
Yeah.
3, 4, and 5 are wrong.
Yeah.
I'm going to take you to somebody who doesn't do this way. Look at the problem in another direction.
Right.
And she was fighting with me till 1 o'clock in the morning. So I said, you know what? I don't need this.
no, you don't need that. I mean, you know, it's...
You are a real saint, Freddie. I mean, I'd have hung up
she's
on
a
that
friend.
person 10 minutes ago.
No, but you see, she's a friend. She doesn't know any better. But when she has that surgery, and she's going to be in that bed in pain, she's going to think about this
You know what
thing.
you should tell her? It's a very easy thing to get yourself out of aggravating yourself. Tell them to look up how many hip replacements were done and how many of them cure the patient. It's astounding how many people who go for hip surgery have a lot of pain. They're on drugs for almost a year. I know 3 or 4
Well, she's
people.
having both of them removed.
Oh, you know how hard that is?
Yeah, she's going to be in bed for 6 to 8 months.
And then she'll be taking narcotics because that's very painful.
Listen, and this is a school teacher. She's not a dummy.
Oh, well.
And she's listening today. Yes,
Well, she's
talking to you.
She's probably looking at disability.
No. She just, and then she goes and she has everybody in her family saying, have the surgery. I said, surgery is failed
Other people
medicine.
don't know. I just alluded to that.
Yeah,
you
that's
have
right.
to be you have to be a responsible party for your own health. Hey, it doesn't cost her anything to come and see me.
Absolutely not.
She could always get it operated. I mean, they have
I told her
operating suites everywhere.
I told her.
And so if it didn't fail in 2-3 days, then she ought to go get it operated. In fact, I would tell you.
I told her that you would say, if I can't help you, go get it operated.
Yeah.
But the problem is the psychology of those 5 doctors, of family members, everybody yada, yada,
no,
yada.
that she's got to put up with all that. And if she does the wrong thing, they're going to criticize her. But remember, you still got to be in charge of your own health. You cannot have someone else tell you what to do. Don't do it.
Before I met Dr. Pannozzo, I wish I would have known him 5 years ago when a relative of mine went in for a double hip replacement. Today, She is walking with a walker.
Double hip replacement.
Double hip replacement. And you know what the doctor said? Well, medicine, surgery is, we can't guarantee we're going to fix you. We go in there, we try.
Yeah, that's right. You can't find these surgeons after they so-called fix you, replace you. You're not finding them
And
again.
then here's a kicker. I don't know the doctor's name, because if I did, Then he took, ready for this one, Doc? He sent her for an MRI. And according to him, the MRI showed that she might have to get another hip replacement.
Of course.
And then my wife, who we didn't know you at the time, said, "You're an idiot."
First of all, somebody who doesn't treat that should never make a recommendation like that.
Exactly.
The guy who reads that MRI is not qualified to tell you that. It's done on a clinical basis.
And it's one-dimensional.
MRI should not be done for that purpose. It should be done for cancer, for other things, but not where the pain is. They can't diagnose that. I mean, I'm taking responsibility off of them. They cannot do it.
Explain
They're not trained to do it, and you have to go through a clinical exam to find it, and you have to know the anatomy. It's not that simple.
Explain to me, we have Atlanta now, and Freddy tells me we got another couple that he's on now that we're going to start doing. Let me explain to the people who haven't heard the show, how do you diagnose a pain? I know Freddy knows. Someone comes into you and says, I was going to get my hip replaced, but I heard you on the radio. Take me through that process so people will understand what it is that you actually do.
Well, like any doctor's office, this is a specialty office.
Mm-hmm.
You have to take a history. You got to find out what the problem is. And there's a special questions that we ask about everything. And then do a clinical examination, so you have to know how to examine. Like, for instance, there's for the lower back, there are 6 parameters that we examine for on a clinical basis. Mm-hmm. And the hip is done in a certain way, so you can tell where the hip is a problem, if at all. If the range of motion is reduced, then you find out where it is, and you explain how you can treat that. And that's how we go. We do a special film, which is patented, my patent, and it's a weight-bearing film. It's a more engineering study than anything else. So it tells you how you bear weight. Mm-hmm. Now remember, if you're weighing 180 pounds, remember 180 pounds is on 2 square inches of your hip. So you have to know why that's one hip and not the other. Mm-hmm. So that's how you have to approach these things. So then you, after you get done with all that, then you offer a treatment for it, and then you do it in a couple of minutes. But there's special treatments. These are not done anywhere. We do them. It's all physician treatment. Mm-hmm. No therapist, no chiropractor, nobody else. Just me and the patient. And that's the highest level you're going to get. I mean, every dime you spend with me, it's got to be worth something to you.
Right.
Because it is the best you can get, and it's a doctor and you. It's not a technician dealing with the surgeon who operates you. You never see him again. I mean, you don't want that.
And where'd you go to school, by the way?
Ohio State.
That's a pretty prestigious
Home
school.
of the Buckeyes.
And you're a medical doctor.
Yes.
Oh, yeah.
I want people to know that we're not,
Well, what this is musculoskeletal medicine.
He's a
In other words,
specialist
it's
in musculoskeletal.
not orthopedic. It's
Right.
musculoskeletal, which means where is the pain coming from?
Source.
And how do you examine for it? It's a source. And unless you have the source, you cannot treat that. Like migraine. We couldn't treat that till we figured out where the source was.
Right.
Now we treat it every day of the week. It's not a big deal.
It's amazing.
And people ought to take care of it. I don't think enough believe it. They don't take advantage of what's out there. Then all they do is complain. Don't complain. Investigate. Try something first.
It's safer to fail.
Yeah.
So if it doesn't work, you're not, okay, it didn't work, I didn't think it was going to work, yada, yada. I'm smarter than everybody else. It's ridiculous. People pay insurance, and if the insurance doesn't cover it, they're not going to have the procedure done.
That's correct.
So you're paying the insurance company not to cover you.
But to not cover you.
Exactly.
So why pay them?
Not to cover you.
And the insurance company is playing a bet. If they don't do anything for you, and you end up going to a surgeon, they'll bet that you're not going to have a surgery.
Of course.
In other words, they saved all that cash, and it's your money. So why was Humana worth $239 a share to be bought by Aetna? Because they didn't pay any money out. They had all this cash laying around, and that was all due to Obamacare. This is all secondary to Obamacare. Mm-hmm. And a couple of years ago, you could had a Humana shares for $33, $29 a share. All of a sudden, $239. Somebody knows where the value is, and I'm telling you, it's in the cash register. They know.
Well, insurance companies don't have medical doctors that you do what you do. So what happens is, if someone has pain, they'll send it. You're covered under Joe whatever, who's a chiropractor. So they send him to the chiropractor.
Oh, everybody sends you to the chiropractor. Yeah. They think they're going to save money that way, but the chiropractor, there's no science there. I mean, how could you even think about sending a human warm body who's paying you to drop your care like that? I mean, you have to really think about this a lot. These people are dropping your care. Instead of sending you to an expert, they're dropping your care to a technician.
Because
don't do it. Don't pay for that kind of thing.
That is people are probably listening and saying, "Oh no, this guy, it can't be true." So you know what I say to everybody? All you have to do is go into his office, 16244 Military Trail. That's all you got to do. Across the street from
Target.
Walmart.
Freddy.
That's it, Freddy. You're out of here.
Block.
When they get on the other end of the mic, you know what? If I'm repeating myself to all the people that listened over the years, there are new radio stations being added constantly by M2.TV, and one of the things we're finding out that a lot of people are saying, "Whoa, this is unbelievable." We're going to start doing seminars around the country, so people could actually meet this man, and you know what? I've seen him diagnose people just walking up and down, and you know what? He's prevented a lot of people. Let me tell you, there's nothing uglier than a boot. Unless you get another boot, and you can wear the two boots, and you can say this is a new style. But women don't want to wear boots.
Well, we had a lady in there a couple of weeks ago who had a whole shopping bag full of boots, braces. I said, throw all that away. You don't need it. There was one shot. She walked out.
You said something about bodybuilders, and I forgot to tell you. So, Matt, I want you to listen to what he says. This is what the bodybuilder, and he's lifting all these heavy weights. I said, I'm just curious, did you ever wear a belt? He says, no, never wear a belt when you lift weights. He said, because it hurts the range of motion. And you always said that you shouldn't do anything to stop the range of motion. So a boot doesn't do anything to help you. It's stopping you from using your leg.
A brace, a boot, if you use a brace on your knee, that's stopping, that's putting you in a bad position. You actually hurt yourself with a brace.
Yeah.
It's about 20 degrees or something in flexion, and you can't walk around like that.
No.
And first of all, it looks dumb. I mean, they change your gait.
Yeah.
And then they put the pressure where you don't want it.
And they're always limping with the boot. You ever notice when people they just start limping? That can't be good for your hip.
Well, they use crutches. But you never want to take motion out of a ligament structure, which is all these are ligament structure. Pain is not from muscle, it's from the ligaments.
So, going back to what I said before, people have to be responsible for their money, you said that, and for their health care. Why would anybody out there, forget we're talking to Dr. Pannozzo, forget, you're not here, okay? Why would anyone in their right mind choose surgery over an alternative?
Well, because
you're not an alternative. You're a medical doctor. You're not an alternative guy that gives acupuncture or cupping.
They're sold a bill of goods because they have pain so long. See, what happens if you try to get a pain thing treated? They send you to a therapy, physical therapy or chiropractor.
Right.
Well, they're not going to treat you because they have no ability to diagnose the source.
They don't know what that's exactly
that problem.
The source.
So you keep going, you keep complaining, And first of all, they say, well, you need surgery, obviously. The chiropractor will tell you that. Therapists will tell you that. Oh, we couldn't treat you, therefore you need surgery. What are we operating? What?
We're not getting rid of where the problem is.
They don't know. See, they don't know. Okay, so now you go to a surgeon who doesn't have to diagnose you because you're already done. Hey,
right.
You're a sharp guy. You're in there for surgery, so let's schedule you for 2 weeks. And that you show up. But that's not good. It's not good for anybody. It's not good for you. It's not good for the insurance company. It's not good for anybody because it's money not should be used to reduce the premiums, not paying the emergency room or the surgical suite, the hospital.
Well, not only that, Doc. The thing that always fascinates me is I have not seen anyone. And I've seen a lot of people over my years that have gone in for surgery. Remember, I know you for a couple of years, but prior to knowing you, I've seen people. Not one of those people have ever gotten cured.
Well, we take care of a lot of post-ops.
Yeah, I know. I see that.
I mean, people come in there, have a back fusion.
You just did from 2 people.
We take care of those surgeries, post-surgery. We take care of the hip replacement surgery has a pain. Usually it's scar tissue. No one wants to treat it. They don't know how.
Right.
They can't do it. I do it. And so that's the follow-up to the surgical people who still have pain. Don't go get another surgery. Let's look at it first. Usually it's easy to treat. Scar tissue is your worst enemy. And there's a plenty of it when they take your hip out or your knee. You know what they'd have to do? They take the patella and they push it all the way over and they cut the knee out. Throw that away, put a piece of metal in there, and then pull that over and sew it up. Well, you got scar tissue now.
It's now up to 146,000 knee replacements that should have been done. Well, we know somebody. I mean, we had somebody, Freddy. Again, folks, if you heard this before, I apologize. There's new people coming on all the time. Had to go in for 2 knee operations because he was a marathon runner. He didn't want to go 2 at the same time, so he went in for 1 first. Okay? When he was done with that, he was telling me he keeps on going to his doctor, and he has pain, and he doesn't like to take medication, but the pain was really bad. I said, I want you to meet Dr. Pannozzo. When he laid down, great patient, laid down, didn't want to tell him about anything else. Dr. Pannozzo gave him, I think it was 2 shots not in his knee, around the knee, I think he gave it. I don't know where he gave. He didn't have to go in for surgery on the second one, and his doctor said, you know, we might have diagnosed this wrong, but this knee is great.
I knew somebody who went in for knee surgery, and they give you a walkthrough. You know, when she's in the bed, and I see that they write on her other knee, not this one.
Yeah. You know why?
Yeah, because they operate on the wrong knee.
That happened to a guy in Tampa.
But they write in this black chalk, not this one. So I said to her, do you want to get the hell out of here? I mean, what are they doing? Not this one? They don't know what knee to operate on?
No, that's common because they've operated on the wrong knee.
That's like the guy that went in for a herniated disc and they operated on his
hernia.
hernia?
Back to lower back pain. It's called discogenic pain. Discogenic.
Discogenic.
That only means it's from the disc.
Right.
Produced by the disc. That doesn't mean anything.
No, okay.
That doesn't mean severity, doesn't mean anything.
So why would a hospital...
And which one?
Yeah, so why would a hospital like Mayo Clinic start doing this?
They will do anything to keep their beds filled, and their medical department haven't figured it out. We have figured this stuff out. When I tell you we figured it out, we really have.
Well, when you said about beds being full, you know how many hospitals go out of business?
We had a knee fella come in there this week. I should write down what I've seen this week because
of course you could. It would be nice for you to tell me.
Anyway, it was a medial knee, inside the knee, on the inside, and it wasn't a knee at all. It was a capsule of the knee. The knee was normal. So you have to break that down. Is a knee normal? What is the knee? It's inside the knee capsule, which holds it together. It's ligaments. So it was on the ligament. So I examined his hip. His hip didn't move. The hip was causing the knee to be injured. Why? Because the hip places the knee in the wrong place for it to work. And what you're going to do, the force of your motion will pull that ligament out and make a sprain. So now you have a knee which is not a knee at all. It's secondary to the hip. So you got to figure this stuff out. This is not easy. We figured it out, and we do it every day of the week.
I'm going to take
at least get a consultation. I mean, if you think that there's a possibility it's treatable stuff, I guarantee you it is.
Come on in and see Dr. Pannozzo. If you want to make an appointment to see Dr. Pannozzo, you can call him at 561-381-5800. We'll be back in about 90 seconds. Thank you.
Hi, it's Leah, here to tell you about Dr. Anthony Panozzo. He's a pain specialist located in Southern Palm Beach County, so if you or somebody that you know is suffering in pain, Dr. Panozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Panozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Panozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon.
You're listening to Dr. Panozzo's Sports and Medicine Hour with Dr. Anthony Panozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-800-889-0267 to get your pain issues resolved. Now, more of Dr. Panozzo's Sports and Medicine Hour.
We be back. Doc, I hope you don't mind. I'd like to take some questions, especially from the people in Atlanta. Are you okay with that now?
Absolutely.
Okay. Alice in Atlanta writes from SurveyMonkey that her 8-year-old son has constant headaches or what she thinks is a migraine. Can he come to see you and be fixed at this early age?
Oh, yeah, better.
Yeah.
The earlier the better.
Well, you always said that the earlier you get somebody in, the better it is, just like with scoliosis.
The younger tissues are really quite good.
You give out the number and they call.
Whoever's calling Dr. Pannozzo, we'd appreciate it if you would call after the show.
We'll call you right back.
And he will call you after the show. The show is over at 12
Yeah,
o'clock.
it's 561 number. Yeah, we'll call you later.
Yeah, we'll call you later. Okay, let me get something from Joe from Google Plus. He writes, your show is really funny and full of information people need to know. I had an injury.
Maybe this person doesn't have the online number.
Well, let me give you the online number. Whoever called Dr.
So
Pannozzo.
if you want to be on the radio, call this number.
Call up Dr. Pannozzo now at 800-889-0267. That's 800-889-0267, and you can ask Dr. Pannozzo the questions.
Yeah, a lot of people want to hear you. They want to know what your problems are because they have the same stuff.
And if you're shy, you don't even have to give your name. Colleen will just say, someone's on the phone to talk to you, and that would be great. So again, 800-889-0267.
Yeah, we're not going to send anybody to your house. Don't worry.
We promise. Okay, so
what's the number?
It's 800 Freddy 897-0267.
No, do that again.
Okay, 800-889-0267.
Got it.
Okay. Boy, I'm telling you, they're really on me today. I'm going to make him. He's a better host than me.
Well, you talk like a New Yorker, real fast.
Yeah,
you
what
got
do
to
you
slow
want?
down. You got to
forget about it. I'm a New Yorker. And
there's more people from Ohio. We don't think too fast. You got to slow down for us.
Okay, let me give this question so everyone out there can hear it. Lara from SurveyMonkey writes, my left elbow hurts when I try to extend it or if I carry lots of dishes to the dishwasher. I am a waitress. I have seen your show and think you can help me. But my question is, how long will it take for my elbow to extend again and not have any more pain? How long will that shot last?
We're talking about a 2-minute cure.
I don't know. Is that too long, Laura? 2 minutes?
2-minute cure.
2-minute cure.
Permanent.
And it's permanent.
Yeah.
Never going to get it back again.
A cure is permanent. I didn't say we treat the pain. No, I said we're going to
get rid of the pain.
Right. We're going to put it on the shirt.
Yes.
Elbow.
Yep.
Freddy's getting funnier than me, Doc. You know that?
I don't know who's his writer.
He stays up all night. I do it in the morning. Okay, Tony from New York City writes in from SurveyMonkey. I've heard that you may be coming to New York City to put on a seminar about pain management. I, for one, would love to attend and hear and see more about what you do. I have a bad knee and have been told they need to replace, which is, if this is true, I am going to retire in Florida. My question is, I've never had knee issues before. Can you explain where the problem is coming from? I have a bad back and had it for years.
Well, you have to consider a bad back could mean inequality of weight bearing. So,
Right.
in other words, he might be beating that knee up because of his situation. He could have a hip along with that.
Right.
So we'd have to figure all that out, examine for all of it, and if there is a weight-bearing issue, then we change that. So we do the whole thing based on the physics of weight-bearing. This is not a medical thing like you get an MRI, you know.
Right.
This is the physics of weight-bearing. It's how the body is constructed. What is it supposed to do, and how does it do it, and then what went wrong with it. So that's how I think. So when I'm examining you, my brain is going, you know, what was the design? Where's the problem here? What can we do about it? And then we do a lot of things for it.
So, Doc, if somebody says they have a degenerate hip, it doesn't mean they have a degenerate hip.
What does that mean, degenerate hip?
That's what I'm trying
It means
to...
an injured hip capsule. That's what it means. Not a hip, but an injured hip capsule. It's a
But
big difference.
degenerate means that it's...
Nothing. Absolutely nothing.
Okay. And that's the stuff they put
See,
out
they're
there.
looking at the hip, and they see this calcium formation in the ligament structure.
Right.
Well, my interpretation is that's a repair process, not degeneration. It's the body's response to an injury. It's not degeneration at all. There is no degeneration. Don't even contemplate that term. Look it up. It means that you're going to be, I don't know, you're going downhill every day. And that's not the case at all.
Terminology is what kills a lot of people. Not understanding the terminology.
The terminology. You have to really know what these people are talking about, especially lawyers and politicians. You have to know what they're talking about when they use terminology. You got to go to that dictionary. I used to go to the dictionary every day of the week. Open that book, pick out a word. In fact, I
did that too when I was
my
younger.
daughter, I punished her by making her go to the dictionary when she was in school and look up 10 words a day. You know, that was the best thing I ever did for her, and she'll tell you today that she was knowledgeable because she just happened to pick up words. And once you get into the dictionary, you pick up more than you want. I mean, you just start reading, and it's the greatest novel there is, the dictionary. You got to read it.
That is wild what you said. I did that when I was in college. I would go and pick a word. I'd go to the dictionary, just pick a word, read what it means, learn how to spell it, and it's amazing how smart you are when you really figure some of these words. And I think what people are doing is they're not understanding the terminology, like a degenerative disc.
Bulging disc.
Bulging
ACL.
is not that means anything.
No, and I mean the one thing that people have to learn is go to someone. Oh, we got Lindy on the phone. I guess Lindy. Hold on, Lindy. I'll give you Dr. Pannozzo.
Okay.
Hi.
Hi there. How are you?
I'm not Dr. Pannozzo. He's sitting right here. Ask him whatever you want.
Okay. I have an 18-year-old son who is a baseball player, getting ready to leave and go play college baseball, and has had a chronic elbow problem since 8th grade, since he was about 13 or 14 years old. And he was diagnosed at that time with osteochondritis dissecans of the elbow and did not play for a year and a half. Started out a rehabilitation program doing, throwing, long toss. Eventually went back, but has always had problems with this elbow. And now he's getting ready to leave for school, and it's actually getting worse again. He has taken all summer off and has just been doing conditioning. Hasn't done any throwing, and then started to throw, and the elbow is hurting.
Well, he's going to people who don't understand the elbow. I mean, none of that's going to work. I can tell you right off the bat it's not going to work. It's only going to get worse. And when he gets to the big leagues, they're going to offer him a surgery on it. You bring him in my office tomorrow, and we'll fix it.
Really?
Yes,
Okay.
Really. I'm not kidding you.
Lindy,
Okay.
is he a starting pitcher or anything like that?
Yes.
Okay.
He's a starting pitcher, and he's also a third baseman.
At third baseman, so he's used to throwing long.
Yes, absolutely.
Okay, so what you're going to have to do is you want to bring him into Dr. Pannozzo as soon as possible.
Okay.
I was a coach
So
for
we
20
can get an
years. If
appointment
I
that
hadn't,
quickly.
yes, because what you want to do is you want him to
I
evaluate.
didn't know that you were a coach.
I was a coach for 20 years, and if I had known this man back in the day, I would have put a lot of more kids up in the majors. You want to bring him in because all that rehab is going to slow him down. His mechanics are going to change. He's not going to be a pitcher. I'll tell you that right now. In college, they're going to move him probably to second base or first
Right.
base if he can hit.
Right.
And
be able to
it
hit
changed his
that's
career.
cool. I mean, he's going to play Division III baseball because he wants to be a two-way player. He does not want to only pitch, but you know, he's worried now about leaving for school in 2 weeks, and you know, doesn't want to tell the coach that he's been having problems.
No, you don't want to do that.
No,
never
you
tell the
definitely don't want
coach
to tell the
anything.
coach that.
When you go into college ranks, you become a number. And when you go into the minor
absolutely,
leagues, you become a
absolutely.
number.
They're going to try to fix everything they see by surgery. Well, you can't do it. First of all, let me give you the background. Anytime you have a pain, you have a scar tissue forming. It's ligaments,
Right.
okay?
Okay. Mm-hmm.
What does the surgery do? Causes more scar tissue.
Creates more scar tissue.
And
Correct.
you,
Yeah.
you lose your career that way. So what you want to do is work with what you have, take the inflammation out, which is what we do, and we do it
Okay.
quickly. I mean, you know, it doesn't take long to do this, and so we like to see people a second day just to make sure that we got everything, and then it's home free. It does not come back.
Okay. Well, I will call in the morning, and we'll come in as soon as we can.
Yeah, all right. That's a good deal.
I want to meet him, Doc.
Oh, you want to meet him?
Yeah, because what happens is
I'm sure
after
he would love to
Well,
meet you
I'll
too.
tell you something, Wendy, which is I'm glad you called because we have a coach here, Freddy, who not only coached baseball, but he did a professional team, and we have Dr. Pannozzo. So, I mean, you know, I'm just a moderator, and these two guys together understand what your son is going through.
Fantastic. Oh, my gosh. This
That would be great, yeah.
may be the answer we're looking for. This would be so wonderful.
It is, and we take responsibility for it, too. So what we're talking about, we're going to produce for you. Just bring him in.
Okay, great. I'll call in the morning. Thank you.
Thank you, Wendy.
excellent call.
Yeah, that's. I mean, my gosh, you know how great that would be. This kid doesn't have to go in for surgery. I mean,
Yeah, we just took care of another pitcher who had a shoulder problem.
Yes, right.
And they wanted to, I don't know what they wanted to do to that shoulder, but I said, don't do anything here. I examined his shoulder. It was a ligament problem, not a tendon problem. And see, every time he came across as a pitcher, he would pull on the back of his shoulder, which caused the pain and inhibit the motion.
Right.
So it took me 2 days, and that shoulder's normal.
Well, you know, it's really important that she called because what's going to happen is you have a pool of players that go in for college. So if somebody has an injury, anything, elbow, shoulder, you're going to put him to the side and take the kid that has none.
Right.
And then you're going to become a project, and they're going to move you, and that's the end of your career. I mean, you're not going to get looked at in the majors. Just not going to happen.
And they just have a trainer, and then they have an orthopedic surgeon. The two things you don't want.
They just don't want you to kill yourself.
Yeah,
But they will put you out the pasture.
musculoskeletal specialist like I
That's
am,
right.
and then we'll take care of it for you. But
It's a good call.
there's no
I'm
amount
excited.
of therapy it's going to do.
No.
See what you went through with
No.
this kid?
Therapy.
Oh, my
What, a
God.
year?
Being
To go for a
off?
year?
You can't be off if you're an athlete.
No,
and
not
it
that.
changes your mechanics.
You
It
can't
changes
hone-
everything. Your
you can't hone
endurance.
your skills.
That's right. And he's at that growing age, you know, between 14 and 18.
Yeah.
Bad move.
That's a good mother. See, she's got her eye.
She
open.
cares.
Yeah.
No,
Guess
she
who's
also
on
has
the
a...
Guess who's on the air listening to this?
Who?
Some guy went. What the heck is this guy? Oh, Dr. Paul.
No, no.
Oh, Paul must have heard the question.
Did you hear that one, Paul?
What's that?
Did you hear the question about the young man that's come to see your dad about a problem with his elbow, right, Freddie?
It's over.
Elbow that's a pitcher, and he doesn't want to take a chance of telling the coach that.
Yeah, Paul does the same kind of work in
Yeah.
Phoenix. So if you're in that area, give him a call.
That's the West Coast, right, Freddie?
That's
West Coast.
west of the Mississippi.
Mississippi, and Dr. Pannozzo is east of the Mississippi.
Right. Yeah, no, I was going to say, I know we talked on the show before about sports teams. And they have they generally have a surgeon there and a trainer, and that's it, and they should have somebody else, with, someone that understands nerve, muscle, and bone medicine, that, but not a surgeon, someone who can treat people medically, these athletes medically without surgical, people that don't need surgery, they can be treated. They should have someone like that on every staff, and it's amazing that even today they don't really seem to have that.
They should have a Pannozzo on the staff.
right.
Yeah, well, there's only so many of us. I mean, there's only
But then
two.
we should have a
There's only
school
two
to
of you.
train them.
Well, why got you both on the air? Let's ask some questions. How's
Hey,
that?
listen, if one of these teams wants to hire us, we'll train a staff for them. And
Why
we'll
not?
Get everybody off the bench.
Yeah.
I mean, just like that.
Even the college team. I'll take a college team right now to let us do our thing and see what happens. Let's see what happens.
They don't want to take a chance, you know. They
Yeah.
just
Chance on what?
There's
Putting a kid
Yeah.
to rehab for a year and a half?
Take a chance on curing somebody.
But the bottom line is there is no side effects of what these two doctors do.
That's right. The knife is always available.
Well, here's what I say. Worst case scenario, it didn't work, which hasn't happened yet. I mean, but you don't have to worry about getting any through. Why go through the knife? Go see these two guys. I mean, if they could get your son or your daughter. How about the girls that are doing the softball pitching in college?
Yeah.
Those ladies have to have some pain.
They do.
That's not a proper motion on the hand toss.
Oh, so I'm all right. Can I ask some questions, guys? And see if both of you want to handle them? Okay. Joe from Survey Monkey says, at night, both the bottoms of my feet feel like 2 buckets of water around them, but no pain. 2 buckets of water, it's got to be painful. When I rest, they feel better, but when I get up, they make popping noises and they don't feel good. My question is, can you explain to me what's going on? Do I have flat feet? Can somebody help me?
He has flat feet.
Oh, yeah, he has flat feet. I'm sorry. So,
Well, he's probably got ankle.
yeah, how do you answer a question like that without looking at him?
You can't
Personally,
answer.
I think that complaint's a little vague.
Yeah.
Without an exam. You need an exam.
But he probably has ankle pain, which is treatable. And the flat feet is treatable, by the way, also. You know, I spent 6 years studying the foot, and I can take a flat foot pain or a patient with flat feet and give them an arch back and take that pain right out.
We talked about you designing a shoe.
Yes.
Remember?
Yeah.
We have to do that, Doc.
We got to do a lot of
That
things.
and the
I
pillow.
had a pillow for a headache, and I can't get around to that either. I mean,
We need somebody to design
have
these
all these
pillows. Give us a
ideas
call.
Colleen, do you know how to make pillows or sew? No.
There you go. There you
Wait,
go.
hold it. We might have Colleen do the sewing for us. Here's a great one. We were just talking about hamstrings. Jack from Port St. Lucie writes, I play for a pro team here in Port St. Lucie, and I'm currently on the DL, which means disabled
Disabled.
with a hamstring pull. Someone told me that you can help heal hamstring injuries. Is this true?
Yes.
Of course it's true.
Let's go up to New York and see the Jets. 4 of their players got hamstring injuries yesterday.
Well, that's really dumb. I mean, there's no reason to be out on the bench for more than a half a day.
But here's what
These
they
all
want him to
treatable
do.
things.
He has 6 weeks before he can start rehab.
Yeah, 6 weeks. What is that all about?
That means he might not play anymore
Well,
after that.
It's like the kid. They put him on a year and a half. No activity.
See, it's so cruel.
Yeah, it is.
You know, don't you agree, Paul? It's so cruel when you say to somebody, I don't care if you have pain or not, you have to wait 6 months.
Right.
What are you telling this person, that they're less than human?
Mm-hmm.
If you can take care of it in one day, why not do that? Why
Right.
make somebody suffer 6 months? Insurance companies do this.
Oh, yeah, no kidding.
I mean, they say, well, you have to wait 6 months. For what? For what?
Yeah, it's true. Hamstring injuries can be treated very quickly. You know, even chronic, even if they're chronic, they can be treated quickly. And it is absolutely true that Medicare guidelines for if you have arthritis pain in your back, they will not cover anything unless you've had documented physical therapy and pain for 3 months.
That is really dumb.
I didn't know that either. Wow.
Yeah, the physical therapists don't know anything about diagnosis. Hamstrings do not come from the hamstrings in most cases. If it does, you have to have blood. You have to be black and blue.
Wow.
Because then you get a muscle that pulls out of the bone. That is a legitimate hamstring problem. It is also injectable. You find out where it is, put a shot in it, it heals overnight. The other part is referred from the lower back. And unless you know how this happens, you're not going to treat it. So those are the 2 things you have to know about hamstring. It's either local or it's referred. If it's referred, that's right down my alley. We know how to do it. Paul knows how to do it. And if it's local, we know how to do that too. So there's no reason for anybody to suffer for any reason.
Dr. Pannozzo, can the groin area...
I'm going to heaven because I don't let anybody suffer. You know that?
Wait, about the groin? Go ahead.
Groin area can get involved with the hamstring?
Yeah, there's 5 areas in the groin unrelated to the hamstring. So 5 structures to be treated there. You could examine for every one of them.
And who's sitting here had hamstring problems?
No, not you.
I had the other one.
Yeah, the groin
I had
problem.
groin problems.
Groin problem. Yeah.
2 shots, guys.
Well, I think we should go to New York.
The 2 structures.
2 structures. Well, it doesn't matter. You fixed it.
Yeah.
Doesn't matter to me what you did.
Let's go to New York. 4 Jet players got injured hamstrings yesterday.
Before we go to New York, I got to West Coast.
Yesterday?
Yeah.
Yesterday.
Yesterday? What happened yesterday?
They had the green and white practice game at the stadium.
Yeah,
they do
practice
this every
games.
year. There were
Yeah.
10,000 fans there.
That's unusual for the
And
Jets.
it was just a practice among themselves, and 4 guys got injury hamstrings. I'm shocked.
Well,
That's amazing in
It
that
is
one
amazing.
practice.
How do you get 4 bad hamstrings in a practice?
I have no idea. Well, for one thing is that everybody that goes to play should be examined ahead of time.
Yes, we talked about
The
this.
pain production examination that we do is irreplaceable anywhere.
Wow. That's
We can
amazing.
pick up any bad thing that happens to these players before it happens
If you are a coach,
because they're not going to tell you if they're
of
hurting.
course not.
Of course not. They want to play.
If you're a coach and you want to get the upper hand on your competition with baseball and football coming up, come and see this man. I tell you, if I had known you,
Oh, God.
all of my players would have come to see you. It gives me an advantage.
Sure
Because I know
does.
who's going to
Yes.
hurt and who's not going to
You
hurt.
see, you're thinking properly
Yeah.
as an executive for this team. You have to make sure your players are healthy so they can produce for you.
That's right.
It's just like hiring miners to get ore out of the ground, and you're going to make money on them. That is what you have to do. You have to manage that whole process. That's how you make a living.
That's right.
And you were trying to get your team to win.
That's
and
right.
you can't win
Yeah.
when they're not able to function. I mean, come on, coaches, you got to understand this.
I don't understand
It's
that mentality.
simple stuff. I mean, if they can't function, they can't produce for you.
I just don't get it. You know, if I'm a high school coach, it should be required. College, you should do it.
So the coaches know the steroid does not affect performance
No.
that you're giving. So it doesn't come up on the list.
What?
And it's like
the
Paul-
shot that you give.
the steroid.
No, it doesn't
and it's
come
like
up.
Paul pointed
yeah.
out last week, it's not a bodybuilding
it's-
stuff.
No.
No, it isn't.
And
It's
it
short
doesn't come-
acting,
yeah.
just anti-inflammatory. It's
Yeah.
short acting. You can't even test for it. Nobody's interested
No.
in that.
And it's where it's placed. The whole secret is that you
Ah.
and Paul know where to put it.
Where to put it.
There it is. That's the secret. That's
These
the
two
secret
guys
juice.
are what I call the pain whisperers. They
He has
know.
to fit that in every
I know
show.
because it's amazing because these guys
amazing. It
know
is amazing.
exactly what's causing the injury.
You're 100%
They don't
right.
have to go in for surgery. Why would you
100%.
want to do this? 561-381
Especially these,
5800. Call, make an appointment.
Especially these young guys on these teams.
Especially.
I mean, that's a shame. I mean,
Well, you know, it's a business.
yeah,
and
when you think about that, the business should be to protect your players.
That's
Exactly.
right. That's why parents, I tell you, protect your investment, which is what the kid is going to be doing.
Sure.
And don't let them change. You know, they change your position
Mm-hmm.
if you can't throw. They'll put you at first base if you can hit. If you can't hit, you're on
So
the
what's
bench.
wrong with that thinking? Change your position instead of curing it?
That's
I mean,
right.
what is wrong with these people?
Ladies and gentlemen, well, I know every show goes really fast, so if you couldn't get in or you want to see Dr. Pannozzo, well, they're calling anyhow. 561-381-5800. Thank you so much, everybody, and Colleen, thank you.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Panozzo. If you spend 5 minutes with Dr. Panozzo, you'll see he genuinely enjoys helping others. Visit Dr. Panozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.